Purpose: to ensure accuracy, traceability, and prevention of cross-contamination during raw material dispensing. This procedure applies to all raw materials used in production. Responsibility: warehouse officer or pharmacist, perform dispensing as per the BMR. Production officer, verify material identity, weight, and labeling. Quality assurance, monitor dispensing activities, line clearance, and GMP compliance. Definition: dispensing is the weighing and transfer of raw materials from their original container into a clean container for batch manufacturing. Use a dedicated clean dispensing area with HEPA filtration and controlled environment. Materials and equipment required: a calibrated weighing balance, clean and labeled dispensing containers or poly bags, PPE, gloves, mask, gown, head cap, and shoe covers, dedicated scoops and spatulas made of approved materials, labels for status, dispense ed, under dispensing, rejected, etc. Pre-dispensing checks: ensure area and equipment cleanliness with QA line clearance. Verify environmental conditions, temperature, humidity, and differential pressure. Confirm weighing balance calibration is valid. Review the batch manufacturing record for material name, code, and required quantity. Collect the raw material from quarantine or approved storage. Verify material name, verify material code, verify batch or lot number. Check expiry or retest date. Confirm the material has a QA release or approved status label. Transfer material into the dispensing booth using closed containers. Wear required PPE, and conduct a final personal check before opening. Open the container carefully to prevent spillage. Weigh the required quantity using the calibrated balance. Record material name in the BMR. Record batch number and quantity issued. Record container numbers and sign the record. Return balanced material to the original container, reseal, and label as partially used. Place dispensed material into a clean container or poly bag. Attach a dispensed material label showing material name, batch number, and quantity dispensed. Include dispensed for batch number, date, and signatures for dispensed by and verified by. Return any remaining material to approved storage under proper conditions. Clean the dispensing area and equipment after use. Record the dispensing activity in the logbook and the batch manufacturing record. Quality assurance will review and sign off the records. Handle materials to avoid cross-contamination. Use dedicated scoops and containers for each material. Ensure balance accuracy before each weighing. Never dispense material without QA release. Do not leave any material unattended in the dispensing area. Follow this SOP to maintain safety, traceability, and GMP compliance. For questions, contact Quality Assurance. Thank you.